Hi, I'm Marty Hatley. I'm a principal with H2Pi, which is the Healthcare Patient Partnership Institute, and I'm joined today by Fabian Armijo from the University of New Mexico Health. Welcome, Fabian.
Thank you, Marty. My name is Fabian Armijo. I'm the Director for Diversity, Equity, and Inclusion for UNM Hospitals.
Thank you, Fabian. Will you briefly tell us what your role was on the team that started the Patient and Family Advisory Committee at UNMH?
I was part of the committee in the capacity as just bringing the perspective of the Diversity, Equity, and Inclusion Office. So I helped with the application process and, helped making sure that we were being as inclusive as possible.
Fabian, in that role, what actions did you take or decisions did you make or contribute to the team that were really driven by consideration for vulnerable populations that are amongst the people that you treat at UNMH?
Before I became the Director of Diversity for the hospitals, I started working as a medical interpreter. So as a medical interpreter, I saw a lot of areas in the hospital where people that don't speak the language of service, in this case English, kind of slipped through the cracks or didn't get the same quality of care as patients that speak English. So what I hope to do and continue to do with PFAC is bring those voices to the table, not only voices, but also we think about deaf patients that come to our hospital for care. So always making sure that those situations and those circumstances and those realities are present in PFAC and brought up.
And Fabian, thinking big now, thinking your biggest aspirations, what impact do you think the UNMH PFAC, Patient and Family Advisory Committee, can have for the patients that your organization serves?
I think that here at UNM Hospitals, we recognize that we have a very diverse workforce, and that workforce serves a diverse community. Here in New Mexico, we have people that live in urban areas like here in Albuquerque and also rural areas, especially our tribal communities. So I think one of the biggest things that we can do with this committee and this council is bring in that diversity into the walls of the hospital and try to make decisions, informed decisions based on what the community actually experiences. We can learn from our mistakes when we have our community involved, telling us what their care was like, how it could have been better. And when we're all at the same table, we can make sure that we're providing equitable care.
Thanks, Fabian. And I'm glad you mentioned the workforce, because I would assume your workforce also is diverse, and the PFAC creates opportunities to bring in diversity in your workforce as well in that membership. Is that part of your plan?
Yes, that's definitely something I'd like to be a part of on the committee. It's really going to advance the way that we take care of patients here at UNM Hospitals by working more closely with the community. And
thanks, Fabian. And just personally speaking, what's been the most meaningful part of the experience to you as?
Personally speaking, I think it's great. I'm from New Mexico. I grew up in rural New Mexico. And I think that anyone that comes through the doors, we're going to take care of them. It reminds me of all of that, taking care of people that are in those rural or farming communities and in the city. Those perspectives will be at the table.
Thanks, Fabian. It's been my pleasure to talk with you today.